how can, how should parents, how should they be dealing with this trauma, and how it might also affect the children, and what are some things that we as a community, as a state, should be doing?
Sure. So, I think that that's a great point that Amanda brought up about the idea of complex trauma, that these are issues on top of issues. And even for a family that wasn't dealing with anything pre-COVID, to have the pandemic and then this secondary trauma, which is kind of a secondary pandemic, if you will, of racism and kind of the immediacy of systemic racism, certainly would qualify as complex trauma. And, first of all, I want to go back to, again, what First Lady Northam so eloquently said about really the parent as the antidote to trauma. And, when we look at the literature around trauma and what helps kids heal and thrive in the face of complex trauma, it is having a caregiver, a parent, guardian, grandparent, whoever that person is, but some loving adult who is a consistent presence in that child's life. And I think what that parent can do, again, as First Lady Northam said, is really provide the structure and the safety for that child. So something that I tell my families a lot is that this is a really hectic and chaotic time. Your routines have kind of gone out the window, but what can really help children stay grounded and to heal through and process what's going on is having the structure and the routines as much as possible. So you may not be able to do your full regular school year routine, but if you can at least pick a consistent bedtime and have a consistent bedtime routine, so your child can count on, okay, at 7 o'clock, I'm gonna have my bath and dad's gonna read me my bedtime story. And that's the thing that child can hold on to. And I think that, it comes back to the idea of putting your own mask on before you put on your child. You've got to do that self-care. And so routines are really good for adults too. I tell people, set limits for your child, but also set limits for yourself. Know when